Well, hello, everybody. Welcome back to our Start or Sit podcast. I'm Shannon O'Kelley, physical therapist, and he's Dr. Hawkins, orthopedic surgeon, sports medicine specialist. Dr. Hawkins, how you doing?
I'm doing great, Shannon. I'm always excited when we get this time of year, really pumped up. We love football. We love talking about it. So this is a great time of year.
Absolutely. And, if people don't are just tuning in or starting to listen to us, our Start or Sit podcast, what we do here, folks, is we look at the previous week's injuries in that NFL game. And for you fantasy football players, we're going to talk about, is that player going to start or is he going to need to sit? And I got to tell you from experience, this is our third year doing this. We're going on year number 3. Are you union yet, Dr. Hawkins? Have you got your union? No, I'm just kidding you. So we're getting there, and Dr. Hawkins is an expert. He is very special. He describes the injury, talks about what the treatment needs to be. We have a conversation about it, and we're going to tell you when that player is going to be back. So you may have to draft. You may have to change your lineup in fantasy football. Just so you all know, Jensen Chrysler here, our production assistant, is a wonderful young man. I was talking to Jensen before we came on the air. The last 3 years, his first year, he drafted Dak Prescott as his quarterback. Lost Dak Prescott how many weeks into the year? Second year, he drafted Aaron Rodgers. Fourth play of the game, first season, he lost that. And your draft pick this year, Jensen, was? Jordan Love. Here we go. Jordan Love, quarterback. So, Jensen, you need to get into a fantasy basketball, okay? Just kidding. But Jordan Love, Green Bay Packers. This kid was on fire last year. Took over for Aaron Rodgers. I saw him have some great comebacks. Here he is playing. I think they played an international game. Was it in Brazil or something like that? And he has a MCL sprain, and it looks like it's pretty significant. What do you know, Dr. Hawkins?
Yeah, he's that was a really, really unfortunate one. You hit the nail on the head with regards to they had that huge travel to go down to Brazil, play against the Eagles, and really it was in garbage time at the end of the game when he was just kind of under pressure, got wrapped up. Very classic thing where the lineman was, on him, leaning into him from the side, had his foot caught underneath the body of that lineman, and so he had that classic valgus or twist bend injury to his knee. And at first, nobody kind of knew. It's the kind of thing where sometimes you break your ankle, sometimes you cause a bad, high ankle sprain. So I think he actually, relatively speaking, got lucky. This is not going to be like Aaron Rodgers the year before. It looks as though the ankle came out okay. He didn't tear his syndesmosis, that tissue between the tibia and the fibula, and it looks like all that energy or that injury happened at the knee. So the MCL is that big, thick ligament on the inner half of your knee, kind of prevents it from bending inwards. And so he got an MRI, no other secondary injury in the knee joint itself, but a relatively substantial grade 2 MCL injury where that ligament sort of gets peeled off the bone a little bit. So very painful, definitely needs to be protected. But for a quarterback who generally doesn't scramble a lot, the good news is they can protect that, let it heal, and ideally have him back. I think their goal was not to put him on IR with the hope that he may not actually need a full 4 weeks till he can come back, but he's definitely not going to be playing this week.
Yeah. I think I read something where he's out at least 3 weeks. And for our listeners out there, if you're new to the podcast, this is why I love doing this with Dr. Hawkins, because we're going to spend a little time at times talking about anatomy, physiology, and maybe a little biology here. And so you should understand, if a player goes on the IR, that means that player is out automatically for 4 weeks. They can't return if they go on the IR for 4 weeks. But when we're talking about an MCL, medial collateral ligament sprain here, remember, folks, the ligament is the rope-like structures that are attaching bones to bones. They're stabilizing that joint. And when that knee gets pushed in, and you guys, you orthopedic surgeons and us physical therapists, we like to grade stuff. So let's talk just real quick about grading these things. You said grade 2. How many grades are there, and what does grade 2 mean?
Yeah, and again, some of it's a little bit fluid, but essentially, a grade 1 sprain, there's no loss of stability, but there's pain associated with it. And then when you get to a grade 2, essentially in certain positions of the knee, you have laxity. So that, again, the analogy I like to give a patient is think of that MCL like a big piece of duct tape that's taped from the bone on the top to the bone on the bottom. And you're sort of starting to peel off one end of the duct tape. And so if you you peel it off sort of halfway, you're going to have some laxity in the knee when you bend it a certain amount. So that's sort of a grade 2 injury. When you get into grade 3, it's just grossly unstable. And in those situations, it's oftentimes potentially an injury to the mid substance of the ligament. So you tore the tape, and or you now have a second injury like your ACL on top of it. So, exactly what you said. When we look at it as surgeons and as physical therapists, if the tape hasn't been torn completely, you want that tape to have time to stick back down again. So grade 2 injuries, they hurt, but sometimes less than grade 1s, but they need time for that to heal. Yeah. And that's kind of back to that whole protect it with a brace, protect it with motion for a little while, do all the wonderful things you guys as therapists do to, decrease the edema, decrease the swelling, get the muscles working ahead of time. So you're sort of prepping things while it's healing. Yeah,
good point. So this is a grade 2. So when we talk biologic healing, essentially what's going on here in this athlete's body is his tissue is going to repair itself. We're going to promote that in physical therapy, enhance that, get him back, return to activity, but it takes time. And with a grade 2, 3 to 6 weeks is usually what I hear about. So he's probably out for at least the next 2 to 3. Keep an eye on him. Is that right?
Yeah, exactly. I think what you'll find out is if he's able to start practicing in 3 weeks, then they'll be shooting to have him at 4. If you don't see him practicing in 3 weeks, he's going to be that 6 week.
Yeah, and when really fantasy footballers out there, I mean, right now with these injuries, I mean, there's a lot going on here. You got to assess the injury. You got to assess where your team is and what this injury is going to look like and when do you need this player back. And this is very important to know this because we're going to talk about a very important player and as our next injured athlete. And this guy is on fire last year. Christian McCaffrey, San Francisco 49ers. I believe he sustained kind of what they called a calf injury during training camp, set out Monday Night Football this last Monday. But now they're coming out and saying, hey, wait, it's not just a calf injury. The Achilles tendon is involved. So what do you think here?
Well, you know this really well, Shannon. Those two structures are intimately involved with each other. So, your calf is obviously the gastrocnemius and a little bit of what's called the soleus muscle. And those things, the confluence, as those muscles come together, they form that Achilles tendon at the bottom. So it's not surprising that a guy who started off with what sounds like probably a small muscle tear, small strain injury, as he's been trying to work through it and push it, he's now led to some inflammation and some pain lower down in the tendon itself. I think, just like you said, with regards to this time of year being important, I think they're being very careful with him because what they don't want is push through it and it lingers into that 6, 8, 10 week process. So I think they're sitting there and saying, hey, if this was week 15 and we had to win the last game to get to the playoffs, he'd play. But right now, we all saw how well they played on Monday night without him, and that undrafted third-year undrafted running back that looked like amazing. Their system is so good that they can do that. So the take home, I think, on Christian is he's probably not going to play this week. I think they feel that they can win without him, and they're going to err on the side of giving him another week to recover. But I think it's important to see week to week. If he's allowed to start practicing Monday and Tuesday, then he's probably going to be a go the next weekend. But they've held him out now this week, and it's pretty clear he'll be out this weekend.
Yeah, a good point. So he's out this. I agree with you 100%. He's probably out this weekend. It's early in the season. I think the guy's name Evans came in and just ran. He ran roughshod, so to speak. He looked great. They have so many weapons. I mean, I think San Francisco. Keep an eye on them. They look like they're going. If everything stays healthy or everybody stays healthy, they're going to be tough. So he's going to be out this week. Keep an eye on him. Maybe next week we'll keep an update on him. And I think all these fantasy football players out there, I bet you if he was available, I bet you everybody drafted Christian McCaffrey.
Yeah, I have him. He was my high pick this year. So, yeah, I got him.
Yeah, you got him. There you go. I was kind of thinking that. For some reason, I was thinking about that. Here, this next gentleman, wow, what a player. Last year, the guy was on fire. Los Angeles Rams wide receiver Puka Nacua. And I think he was a rookie last year, and I think he set some rookie records. And the other receiver was out last year. He's great. What's his name again?
Cooper Kupp.
Yeah, that's right,
Cooper
Kupp. He's a Washington State. I mean, he grew up in Washington State. Great kid. That's right. And they're both back together, but Puka, it looks like he's got this weird, we don't hear much about this ligament, so I want to spend some time here. Instead of the ACL, we're talking about the PCL. So we know how the ACL is torn and the mechanism and how prominent it is. This PCL thing is usually like a car accident. What's going on here?
Yeah, so the PCL is sort of the opposite of your ACL, and obviously we don't have a visual now for our listeners, but think of it as a ligament that's running sort of from front to back, from the femur, the thigh bone on top, to the tibia, low bone on the back. And just like you said, the classic described injury is like a dashboard injury. Mm-hmm. Your knee's bent to 90 degrees, and you didn't have your seatbelt on, and so when you crashed into something, the front of your knee just below the kneecap hits the dashboard and pushes the lower bone backwards. And so that can tear or injure it. Well, in a football player, it's usually a hard fall on the front of the knee, oftentimes with a big player on top of you. And so believe it or not, and our listeners probably don't know this like you do, but that's the number one undiagnosed injury that is picked up every year at the combine for NFL players, because a lot of guys sprain their PCL and it heals with a little bit of laxity, but they get back in and they're playing and not having any issues. But then when you examine them and you compare their two knees, you can diagnose it. So the good news about the PCL is it heals. That's the whole point of what I brought up there. It heals, but you want to protect it because you don't want it to tear completely, because then potentially you've got an issue. So, I don't remember the actual point in the game that it happened. I don't remember something that stood out, but my expectation is he came down hard on the front of the knee. He is potentially a franchise player for them in the long run. So he 100% is going to be out for 4 weeks to let this heal. And I'm pretty sure they were putting him on the IR. So it's a guaranteed 4 weeks.
Yeah. Okay. Yeah. That interesting. I watched the game and I didn't see any specific play where it may have occurred, but it's an interesting ligament, because I think what you said is interesting, that a lot of this is an undiagnosed ligament. This is a ligament that's good for stability, but not necessary like the ACL is for that anterior medial instability of the knee. Your PCL, so you can rehab this, you can return into 4 weeks. If this was a grade 2 ACL, it would take longer, I would imagine. Is that fair to say?
Correct. Yeah. And my guess is, a lot of times they have some discomfort. They have some loss of range of motion. There's a little bit of swelling involved, but it's usually outside the knee joint, but it's hard to do like deep squatting, deep bending initially. And so, it's definitely been shown that, if you protect that deep flexion for a little while, it's going to heal tighter. And so that's really the goal here. It's actually an extra articular ligament, even though it sits next to the ACL.
That's right.
It's outside the synovial line. And that's why it can heal. Yeah.
Yeah, I love these. I love these anatomical words for our listeners. The synovial lining, just real quick, the synovial lining is your capsule. We call it a capsule in medicine. We call it a capsule, and that encases or encapsulates the joint. And inside that synovial lining is fluid. And this ligament PCL sits out of that, so it's an extra articular, we call it. Just a little anatomy 101 for everybody there. Dr. Hawkins, you are awesome. I mean, the way you explain things, and even though we're on radio, the visual is great. Let's talk about, boy, this team is on fire. I'm looking for good things if they stay healthy. Is this Dallas Cowboys, but they're tight end. This guy's a big man. Jake Ferguson, another MCL strain. Excuse me, it's not a strain, but a sprain, MCL sprain. But he also has what they call bone bruise, which is kind of a double whammy. Let's talk about that a little bit.
Yeah. So again, back to when we talked about how those ligaments, like you said, they're ropes that go bone to bone and they stabilize the knee. So, when he gets hit from the side and that one ligament gets injured, it gets stretched. If the force is hard enough, it allows the other side of the knee, the ends of the bone, to essentially bang up against each other. So that's what you end up here. You sort of end up, in the brain, they talk about, when people have a concussion and the brain sloshes around, you have sort of what they call like a the fancy term is a contra-coup injury.
Exactly.
So
Yep.
the brain goes one side, hits on one side, and then bounces back. So that's kind of the thing. So oftentimes these bone bruises are on the opposite side from where the MCL is, because they get hit from the side. And again, just like anything else, the body's alive. Bone bruises hurt. They take some time to heal. The simplistic example that I'll use a lot of times, for a visual example, is think of the apple that falls off the side of your table and hits the ground, and then there's sort of that soft spot.
Yep,
so
that's right.
That bone has been damaged, and so the cartilage overlying it's been damaged, and so unlike an apple, our body can repair that, but if you want to protect it while it's in that sort of softened stage.
Yeah, it's interesting. So, but it's very painful. Like you said, that bruise, sometimes, I mean, I've had patients that have bone bruises, and because the bone is lined with this covering we call periosteum, which is highly vascular, it has a lot of blood vessels, but it has a lot of nerve innervations. And it's very sensitive, isn't it? I mean,
yeah, absolutely. And so and the interesting thing for him is, like you said, he's a big guy, but he is a tight end.
Yep.
He's not an incredibly super mobile tight end. He's not George Kittle.
Yeah,
so I think he may be a little bit of a game time decision depending upon how they're feeling. So I'm assuming they're going to get him a pretty heavy hinge knee brace. So it tries to take the stress off of one side, unload the other side a little bit, see if he can practice. So for people who have him on your fantasy team, because he can be a productive tight end, I would kind of look at Friday. Is he a full participant in practice on Friday? If that occurs, then I would probably keep him in your lineup. I think it would be worth the risk. But you should have a backup plan if he doesn't practice on Friday.
Yeah. So you're kind of coming at this 50-50. I mean, he's going to be what you would call game time decision. Now, let's just review this. I think in the NFL, do they have to announce by Friday who's in and who's out, and do they have to submit their roster? Is there any time period? Do you know anything regarding that?
No, technically you can go right up to, because that's what happened with McCaffrey last week. Right. He was questionable, and then an hour before the game they said he's out. Right. So those are the tough ones for the fantasy players out there, because you're in total scramble mode. So that's why, again, if you're the kind of person who carries a team and carries backups, you really want to kind of look closely. Do you have a backup tight end? And if not, who's on waivers that you could pick up that would potentially be a starter, a second or third tier guy that's out there that might be able to fill in if suddenly he drops.
You might want to pick up Gronk, huh? Okay, no, I'm just kidding.
There you go.
There you go. Yeah. Okay, so
hey, listen, if you get points for all the ads he's in nowadays.
Oh no,
yes.
Oh no, kid. Just real quick, did you hear? I mean, you got to get your opinion. I don't know. The big news and the big talk was Tom Brady did his first broadcasting. I thought he was pretty good. I thought he was pretty good. Did you hear him at all, Dr. Hawkins?
Yeah, here's the bad thing. I totally missed it. I didn't get to see him at all.
Okay.
So I'm kind of bummed about that. I was one of those ones where I was like, you know what? I was unfortunately my professional duties kind of kept me away from actually watching football. But yeah. So I got the same feedback from people who did see him. They said, hey, he was pretty good. Definitely didn't do anything awkward or weird. In that same vein, and I don't know if you heard this, but apparently Jason Kelce is going to be doing the Monday night game this week. So that's what I'm all fired up now as my Eagles background. I can't wait to I can't wait to see Jason Kelce out there doing Monday night. So.
I saw him he was doing some backup on Monday night. I think it was the pre-game show, and he's good. He's got great energy. Yeah. He's good. And I feel bad. Tom Brady's a very talented guy, obviously, but that guy lives underneath a microscope, right? And there's people out there, when you're that talented, the expectations, I think people are just sitting on there waiting for him to make a mistake. And I thought he sounded good, And so, hey, let's talk about a right ankle here. This guy is pretty important, meaning the Minnesota Vikings wide receiver, Jordan Addison. Now, here's the deal. The Vikings have to play San Francisco. I think they're up against San Francisco this week, and he's a game time decision. I think he had an ankle, kind of one of those ankle sprains, lower ankle sprain, I believe, and it sounds like it's probably a grade 1. Maybe just review that for us.
Yeah, absolutely. The big concern initially, he had a high ankle sprain, I believe, on the contralateral side last year.
That's right.
Yeah, so their concern was obviously, is this another problem? Because those are much more problematic. But like you mentioned, I think the consensus after follow up and imaging on him is that a low ankle sprain essentially involves the short ligaments that stabilize the bones right around the ankle, what's called the talus, the calcaneus, to the very bottom bones, the tibia and the fibula that form the box, so to speak, that stabilizes the ankle. So typically if we have that, like we all step off a curb and twist our ankle inwards, that usually hurts that front side ligament called the ATFL, and that's a grade 1 sprain. They're uncomfortable, they're stiff, but the rest of the ligaments are okay. So usually if they can get the swelling under control, they'll usually tape him up very well. Sometimes they'll put a low profile brace on, though. For a wide receiver, that might be a bit much. So it does, like you said, look like he's going to be a game time decision. And again, with all the weapons that the 49ers have, the Vikings are really definitely going to have to, take advantage of having Addison and see if Sam Darnold can continue to be, successful for them.
Yeah, Sam Darnold. I mean, he lit it up last week, didn't he? I mean, he did well.
Yeah,
I mean, I think
he really did.
Good for him. Good for him. The guy that I don't know if you ever seen on Netflix. I don't know, a couple of years ago they had a series come out. It was called Quarterbacks, and they followed Patrick Mahomes. Kirk Cousins, and then Marcus Mariota, right? And they followed these people through the season. Yep. And Kirk Cousins is a good guy, and he started for the Vikings last year. Obviously had an Achilles tendon tear, I think, towards the end of the season. They traded him to Atlanta, and he almost won his game this week. And they had like a minute left to come back in the fourth quarter. They needed to score. Man, Kurt threw a touchdown. I felt bad for him. And I like Kirk Cousins. He's a nice guy. So last
that show made me enjoy him. Like, I did not like Kirk, and I watched that show and I was like, I love this guy.
Yeah, me too. Me too. You're exactly right. That's exactly right. So here we got to give a shout out to the Seahawks. They did not look good essentially the first half of the game. I was a little nervous, but somehow someone plugged this guy, Kenneth Walker, in, and this guy just went off, and he had a heck of a game. I think he ran for close to 100 yards. The second half, he owned the second half. However, he was a little nicked up towards the end of the game, and I think he went out. Now I'm reading that he's got one of these abdominal injuries. I mean, doesn't sound like it's too significant, but I mean, that's a trunk injury, that's a torso injury, and you do almost everything starting with your core. I don't think he's going to be a problem. Do you?
No, I think we got a little bit lucky for the Seahawks with him. We always worry when they bring up abdominal injuries, it starts to make us wonder that whole sort of, athletic hernia issue. So the athletic hernia, those types of problems tend to be very low abdominal injuries. It sounds like he's just sort of a core strain. Maybe a little painful, maybe a little bit hard, but I think he's going to be able to play, and I think he'll be able to stay productive. And I think, it's pretty evident that I think the Seahawks obviously need all parts of their offense to be functioning well, to be successful, Yeah,
their offensive line came alive. I mean, we're hopeful. We're hopeful. I don't know, Jensen, who do we have this week in the Seahawks? I got to check that out. Well, now that we're into the football season, we got week 1 underneath our belt. We'll get a lot more attuned to what's going on. Okay, Jensen, you and me, we'll work together. Dr. Hawkins, man, it's so good to talk to you again. Just starting our 3rd season here, ladies and gentlemen, of Start or Sit. Again, this is the podcast that we do to talk about your fantasy football player. Is that athlete have an injury? What kind of injury is that? When are they going to return? And what are the chances of them playing this weekend? Stay tuned. We'll be back next week for week 2 of Sit or Start NFL season 2024-2025. We are super excited. Dr. Hawkins, you are awesome. Thank you again.
Thanks again, Shannon.